Hello YouTube, I'm going to talk about contraception after birth. Okay, first of all, how long should you wait after having your baby to start having sex again? There is no set time limit. This depends on you and your partner. Having a baby brings huge physical and emotional changes not just to you, but also to the baby's dad. So not wanting to have sex for a while is completely normal. The only rule is that you shouldn't have sex before you feel physically and emotionally comfortable doing so. If you feel under pressure, talk to your partner so he knows it is not because you are not attracted to him, and if necessary, ask your doctor to talk to him as well. Okay, first question. How long does it take to start ovulating after you've had a baby? It can take as little as 4 weeks and as much as several months. In part, it depends on whether you are breastfeeding or not. Some breastfeeding mothers take months to start ovulating again, but others can start 4 weeks after their baby is born. Then, when will your period start again? Again, this differs from woman to woman and partly depends on whether you are breastfeeding. Most breastfeeding mothers, but not all, don't have a period for a few months, and mothers who are not breastfeeding usually get their first period 5 to 6 weeks after giving birth. Next, do you need to use contraception after you've had a baby? If you don't want to have another pregnancy immediately, you need to start using contraception from 21 days after you give birth. During the first 3 weeks, it's not possible to become pregnant. It is a good idea to get contraception ready while you are pregnant or while you are in the hospital, so talk to your doctor or midwife during your antenatal visits. Remember, you can still get pregnant even if you have not had your first period after giving birth because you ovulate 2 weeks before the period starts. So if you want to control when, or if you have another baby, don't have sex until you have contraception in place. Don't wait until you have your first period or you have seen doctor for the 4 to 6 weeks checkup. Okay, next question. What sort of contraception should you use? Discuss this with your doctor and with your partner. The contraception choices are largely the same as they were before you had a baby. If you're breastfeeding, you may find you are protected naturally as your baby is releasing a hormone called prolactin which stops ovulation. This process is known as lactational amenorrhea or LAM. However, this method is only completely safe if you are exclusively breastfeeding, the baby is less than 6 months old, and you have not had a period since you gave birth. As soon as you start stopping night feeds, leaving longer between feeds, topping up with bottle feeding, or getting your periods, breastfeeding is no longer an effective contraceptive. You can start using hormonal methods of contraception, the pill, the patch, the ring, and the injection from 3 to 4 weeks after giving birth. However, check with your healthcare provider because some of these forms can mean you produce less milk or the progestin only or mini pill may be best at first, and the combined, estrogen and progestin pill, ring or patch only when you have an established feeding routine about 4 to 6 weeks. If you are intending to become pregnant again soon, don't have the injection as it is effective for several months, even up to a year. You can also have an intrauterine device or IUD inserted immediately after delivery or at the 6-week checkup, which will give you effective, long-lasting protection. If you choose to have an IUD inserted at the 6-week checkup, make sure you are using another method if you have sex before them. If you are planning to become pregnant again, this may be your best choice as it can be taken out at any time and you will immediately be fertile again. You can safely breastfeed if you have an IUD. Male or female condoms can be used and will protect you not only against another pregnancy but against sexually transmitted diseases or STIs. Cervical caps and spermicides can also safely be used. If you decide you do not want another pregnancy in the future, you or your partner can be sterilized by vasectomy for him or tubal ligation for you. Doctors usually do not want to carry out this operation just after your baby has been born because they want you and your partner to think it through properly and not make a snap decision. Some women decide to be sterilized because they have had a difficult experience but then regret their decision later. Okay, another question would be, can you use emergency contraception or morning after pill? If you have unprotected sex earlier than 21 days after giving birth, or you think your contraception might have failed, for example, a broken condom, then you can safely take the emergency pill. However, if you take the LO1 brand, don't breastfeed for the next 7 days. In 28 days have gone past since giving birth, you can use the emergency IUD. Okay, last question. When should you get pregnant again? If you are planning another pregnancy, you should start charting your cycle so you can have sex when you are most fertile. However, we recommend that new mothers wait at least 1 year to become pregnant again to reduce the risk of complications. That said, many women do become pregnant sooner than this and have healthy pregnancies and second babies. Your healthcare worker will be able to advise you. Okay, thank you for watching. See you soon.